Hi, I'm Dr. Bergeron. I wanted to talk briefly today about male chest liposuction. Male chest is a common area that we treat with liposuction. I'll have men come in that complain of enlargement of the chest or enlargement of the breast tissue. Sometimes they say they've had this since childhood, or sometimes this came on during periods when they gained weight. They'll say that they don't like the way they look in t-shirts, or they'll use terms like man-boobs, etc. But to talk about male chest liposuction or liposuction of the excess breast tissue, we need to talk about gynecomastia, and true gynecomastia versus false gynecomastia. So by definition, true gynecomastia is an accumulation of excess glandular tissue in the male breast. This accumulation of glandular tissue happens during times of imbalance between the hormones testosterone and estrogen. Men, of course, have mostly testosterone and a small amount of estrogen, but if too much of their testosterone converts to estrogen, then they get this excess accumulation of breast tissue. So that's true gynecomastia, or just commonly called gynecomastia. So the other side is false gynecomastia, or we use the term pseudo-gynecomastia, which is just an accumulation of fat in the area, in the chest area. So just like you can accumulate excess fat in your stomach or your love handles, some men just tend to accumulate it in their chest area. So that's pseudo-gynecomastia. So glandular tissue versus mostly fat tissue. Now, most men that I see have a combination of both. So my goal is to determine how much of that is glandular tissue, how much of that is fat, to determine whether they're a good candidate for liposuction. So on the consultation, I'll ask questions like, when did you first notice this enlargement of the breast tissue? Was this during puberty? Or did this happen during a time of your life when you gained weight? I'll also ask a question like, if you lose a lot of weight, do you like the way it looks? Or when you lose weight, do you still have a protrusion under the area of the nipple? And their answers kind of lead me to whether I think it's mostly glandular or mostly fat. If I think it's mostly fat, I can get a good result from liposuction of the area. And I can show you some, go to pictures now, and we can look at 4 cases of men that I did treat with liposuction of the chest area. So the first photo, this male is in his 30s. In this case, I'd say the volume of fat removed was about 600 cc's, a little bit more than a pint total, pint of fat. But you can see good reduction here in the size of the chest. This is the before, and this is the after. You can also see this male does have a little bit of asymmetry in the the before photo. You can see it looks like his left breast tissue is a little more than the right. And even though there's a reduction in the after, you can see still see a little asymmetry there. And this is common with liposuction. The next photo, this is just a side view of the same gentleman. So the second case, this is an African-American male in his 30s. Total volume in this case, about 500 cc's of fat was removed from the chest area. 500 cc's, that's about a cup of fat from each breast. One thing I'd like to point out from the before, if I circle his breast tissue, you can notice so one thing I'd like to point out on this, in the before photo, you can see the nipple kind of has this downward projection. Whereas in the after photo, You can see that he's got good skin retraction, and now the nipple has a more horizontal projection, a more natural appearance. This is actually another view of the same patient, but you can see good reduction. This next gentleman is in his 30s, a little smaller volume case. There's about 400 cc's of fat was removed, or a little under a cup from each breast. Again, you can see in the after photo more lean appearance, the breast tissue, and more horizontal protrusion or projection of the nipples. Next photo is just a different view of the same patient, but you can see, again, good reduction in the amount of breast tissue in the after photos. Okay, our last case, this is a male in his 20s. This is even a smaller volume, about 300 cc's of fat total, or 150 cc's, a little over a half a cup of fat under each breast was removed. And again, you can see in the after photo, just a more lean appearance in the chest, more definition of his pectoral muscle, good overall result. Next photo is just another angle of the same patient. So I hope this little video helps you understand a little bit about chest liposuction and the difference between true gynecomastia and false gynecomastia. As I mentioned earlier, it does really require physical exam and clinical judgment to determine whether a patient's a candidate for chest liposuction versus another procedure. So I do encourage you to come in for a consultation.